10 advances that transformed infection, diagnosis, surgery, and survival. This countdown moves from number 10 to number 1, with each archive leading into the next. We begin with smallpox vaccine, the breakthrough that changed medicine. The smallpox vaccine is used to prevent smallpox infection caused by the variola virus. It is the first vaccine to have been developed against a contagious disease. In 1796, British physician Edward Jenner demonstrated that an infection with the relatively mild cowpox virus conferred immunity against the deadly smallpox virus. Cowpox served as a natural vaccine until the modern smallpox vaccine emerged in the 20th century. From 1958 to 1977, the World Health Organization, WHO, conducted a global vaccination campaign that eradicated smallpox, making it the only human disease to be eradicated. Although routine smallpox vaccination is no longer performed on the general public, the vaccine is still being produced for research, and to guard against bioterrorism and biological warfare. The advances surrounding smallpox vaccine lead to germ theory of disease, where a different medical barrier became manageable. At number 9, germ theory of disease, the breakthrough that changed medicine. The germ theory of disease is the currently accepted scientific theory explaining the cause of infectious diseases. It states that microorganisms known as pathogens or germs can cause disease. These small organisms, which are too small to be seen without magnification, invade animals, plants, and even bacteria. Their growth and reproduction within their hosts can cause disease. Germ refers not just to bacteria but to any type of microorganism, such as protists or fungi, or other pathogens, including parasites, viruses, prions, or viroids. Even when a pathogen is the principal cause of a disease, environmental and hereditary factors often influence the severity of the disease and whether a potential host individual becomes infected when exposed to the pathogen. The advances surrounding germ theory of disease lead to Ignaz Semmelweis, where a different medical barrier became manageable. At number 8, Ignaz Semmelweis, the breakthrough that changed medicine. Ignaz Philipp Semmelweis, German, Nats Philipp Semmelweis, Hungarian, Semmelweis Ignaz Fulop, Semmelweis Ignaz Philop, the 1st of July 1818 to the 13th of August 1865, was a Hungarian medical doctor and scientist of German descent who was an early pioneer of antiseptic procedures and was described as the savior of mothers. Postpartum infection, also known as puerperal fever or childbed fever, consists of any bacterial infection of the reproductive tract following birth and in the 19th century was common and often fatal. Semmelweis demonstrated that the incidence of infection could be drastically reduced by requiring healthcare workers in obstetrical clinics to disinfect their hands. In 1847, he proposed hand washing with chlorinated lime solutions at Vienna General Hospital's first obstetrical clinic, where doctors' wards had thrice the mortality of midwives' wards. The advances surrounding Ignaz Semmelweis lead to 1854 Broad Street cholera outbreak, where a different medical barrier became manageable. At number 7, 1854 Broad Street cholera outbreak, the breakthrough that changed medicine. A severe outbreak of cholera occurred in 1854 near Broad Street, now Broadwick Street, and Golden Square in Soho, London, England, during the worldwide 1846 to 1860 cholera pandemic. The outbreak, also known as Golden Square outbreak, which killed 616 people, is best known for the physician John Snow's study of its causes and his hypothesis that germ-contaminated water was the cause, rather than something in the air called miasma. This discovery influenced public health and the construction of improved sanitation facilities beginning in the mid-19th century. Later, the term, focus of infection, was used to describe sites, such as the Broad Street pump, where conditions are favorable for transmission of infection. The advances surrounding 1854 Broad Street cholera outbreak lead to pasteurization, where a different medical barrier became manageable. At number 6, pasteurization, the breakthrough that changed medicine. In food processing, pasteurization is a process of food preservation in which packaged foods, e.g., milk and fruit juices, are treated with mild heat, usually to less than 100 degrees Celsius (212 degrees Fahrenheit), to eliminate pathogens and extend shelf life. Pasteurization either destroys or deactivates microorganisms and enzymes that contribute to food spoilage or the risk of disease, including vegetative bacteria, but most bacterial spores survive the process. Pasteurization is named after French microbiologist Louis Pasteur, whose research in the 1860s demonstrated that thermal processing would deactivate unwanted microorganisms in wine. Spoilage enzymes are also inactivated during pasteurization. The advances surrounding pasteurization lead to penicillin, where a different medical barrier became manageable. At number 5, penicillin, the breakthrough that changed medicine. Penicillins, PCN or PEN, are a group of lactam antibiotics originally obtained from Penicillium molds, principally P. Chrysogenum and P. rubens. 8 species of Penicillium, in the section Chrysogena, produce penicillins. Most penicillins in clinical use are synthesized by P. Chrysogenum using deep tank fermentation and then purified. A number of natural penicillins have been discovered, but only 2 purified compounds are in clinical use, penicillin G, intramuscular or intravenous use, and penicillin V, given by mouth. Penicillins were among the first medications to be effective against many bacterial infections caused by Staphylococcus and Streptococci. The advances surrounding penicillin lead to insulin, where a different medical barrier became manageable. At number 4, insulin, the breakthrough that changed medicine. Insulin, from Latin insula, island, is a peptide hormone produced by beta cells of the pancreatic islets encoded in humans by the insulin, INS, gene. It is the main anabolic hormone of the body. It regulates the metabolism of carbohydrates, fats, and protein by promoting the absorption of glucose from the blood into cells of the liver, fat, and skeletal muscles. In these tissues the absorbed glucose is converted into either glycogen, via glycogenesis, or fats, triglycerides, via lipogenesis. In the liver, glucose is converted into both. Glucose production and secretion by the liver are strongly inhibited by high concentrations of insulin in the blood. The advances surrounding insulin lead to history of general anesthesia, where a different medical barrier became manageable. At number 3, history of general anesthesia, the breakthrough that changed medicine. Throughout recorded history, attempts at producing a state of general anesthesia can be traced back to the writings of ancient Sumerians, Babylonians, Assyrians, Akkadians, Egyptians, Persians, Indians, and Chinese. Despite significant advances in anatomy and surgical techniques during the Renaissance, surgery remained a last resort treatment largely due to the pain associated with it. This limited surgical procedures to addressing only life-threatening conditions, with techniques focused on speed to limit blood loss. All of these interventions carried high risk of complications, especially death. Around 80% of surgeries led to severe infections, and 50% of patients died either during surgery or from complications thereafter. The advances surrounding history of general anesthesia lead to Joseph Lister, where a different medical barrier became manageable. At number 2, Joseph Lister, the breakthrough that changed medicine. Joseph Lister, 1st Baron Lister, the 5th of April 1827 to the 10th of February 1912, was an English surgeon, medical scientist, experimental pathologist and pioneer of antiseptic surgery and preventive healthcare. Lister revolutionized the craft of surgery by the use of close anatomical observation, in the same manner that John Hunter revolutionized the science of surgery. From a technical viewpoint, Lister was not an exceptional surgeon, but his research into bacteriology and infection in wounds revolutionized surgery throughout the world. Firstly, as a surgeon at the Glasgow Royal Infirmary, he introduced carbolic acid, modern-day phenol, as a sterilizer for surgical instruments, patients' skins, sutures, surgeons' hands, and wards, promoting the principle of antiseptics. The advances surrounding Joseph Lister lead to ABO blood group system, where a different medical barrier became manageable. At number 1, ABO blood group system, the breakthrough that changed medicine. The ABO blood group system is used to denote the presence of one, both, or neither of the A and B antigens on erythrocytes, red blood cells. For human blood transfusions, it is the most important of the 48 different blood type, or group, classification systems currently recognized by the International Society of Blood Transfusions, ISBT, as of June 2025. A mismatch in this serotype, or in various others, can cause a potentially fatal adverse reaction after a transfusion, or an unwanted immune response to an organ transplant. Such mismatches are rare in modern medicine. The associated anti-A and anti-B antibodies are usually IgM antibodies, produced in the first years of life by sensitization to environmental substances such as food, bacteria, and viruses. That was top 10 breakthroughs that changed medicine. Every story in this countdown began as a shorter archive, but the connections only appear when the files are placed together. Subscribe for the next collection.